Good afternoon, everyone. Thanks for joining us on this media briefing for Friday. We are going to get started today with one of our Office of Emergency staffers. Luna Mohammed is an emergency services planner, and she has been involved in a COVID-19 business impact survey. We talked about it a few months ago, but she's going to give us an update on the survey and also a survey done about the COVID impacts on nonprofits. So, Luna, are you with us?
I am. Hi, everybody.
Hi, good afternoon.
So I'll start sharing my screen right now, if that's okay.
That would be great.
Wonderful. Okay. All right. So we started the COVID impact surveys at mid-March, right around the time we were doing the shelter-in-place order. It initially started with the business survey. The purpose of it was to demonstrate the need for SBA assistance so we could get approved. We were approved 2 days after pushing out the survey. And within those 2 days, we received over 600 responses. Based on that, the Office of Emergency Services had a discussion. We decided to add in a nonprofit survey and to further push out that business survey. We modified the survey a bit to be more quantitative in nature. The first round was really pushed out very quickly so that we could get that SBA assistance. So it was much more of open-ended questions, which makes it much harder to analyze. So we switched to a more quantitative format, pushed out a second round on April 1st. Of both surveys, the first round of the NGO surveys and the second round of the business surveys. The links for both surveys are on this this page, on this PowerPoint slide, and both can also be found on Monterey County's Office of Emergency Services website. So what we ended up finding, overall, I combined both rounds of the business surveys, and this is all of the data as of June 4th. We had 697 separate businesses take the survey, and we had about, I believe, 900, a little over 900, survey participants total. The reason that we see that 300 difference is people are encouraged to update their responses, so they would take a second round of the survey. So about 300, a little less than 300 businesses took 2 to 3 more rounds of the survey. And I do encourage you, please do push this out to as many people as possible. If a business or organization's already taken a survey, retaking it, especially as we're reopening, is a really good idea. That way we can better understand what's happening now, as opposed to what happened while we were sheltering in place. And so this is just a brief overview of how many people are employed by each business, where each business fits into, so food and beverage, healthcare, and the like, and where in the county the physical location of the business is. That's not necessarily where we're being served. And for this survey, most of the people who took the survey, or most of the organizations who took the survey, were from the coastline, so the Monterey Peninsula area. And it is important that we get feedback from different regions. So I really would love to see that North and South County and the Salinas area survey participation grow so that we have more accurate of an analysis. So the NGO survey, we had less survey responses, about 115. And again, the physical location was near the coastline. Here we did ask how many people were served, not just employed. Just like the business surveys, we saw 1 to 5 people was the average for people employed, but as far as people served, most of those NGOs do serve more than 1,000 people. And a lot of them are in education, child and health, or arts and recreation services, although we had a pretty broad array of categories for that. So the key takeaways from the business survey: 84% of the business survey participants noted a change in gross revenue. I do want to note that people have been taking the survey from mid-March. So a lot of people also noted, hey, we don't know what's going to happen yet. We barely closed today or yesterday. But what we did see was that some businesses, especially tourist businesses, started feeling the impacts in January, and the biggest growth was early to mid-March. And sorry. And many noted that they slowed down slowly before that shelter in place, but the shelter in place was pushed as a catalyst for completely slowing down or shutting down. So a lot of those businesses started with a slowdown and turned into a shutdown with a shelter in place order. And this is just a brief on the top right, an overview of the dollar amount of change and percent of change. So a good amount of businesses, 38%, noted 100% change in revenue. When they closed down, they lost all their revenue. On average, we saw a 75% change in revenue when you combined everybody's data, and about $138,000 of loss. And again, that is from March to June. So some of that loss, I would presume this is showing a lower amount than what is most likely the current data, since it is including some of that March data and April data. For the NGO surveys, we saw a lot more of the organizations still working. A lot more noted that they grew. About 10% of the businesses or organizations who took the survey noted they grew, and a lot more noted they slowed as opposed to closed. And the impacts tended to occur a little later for the NGOs. It seemed like they were more responding to the shelter in place order than feeling that slowdown before the shelter in place order took place, unlike the businesses. So for the businesses, there was a 29% of those businesses had a shortage of employees, 51% had to lay off employees, 63 had to cut employee hours, and on average, 10 employees had their hours cut, and the hours cut was about 29 hours per employee. On the top right, they just described some of the impacts that this has had on the business. And I pulled these quotes because I felt that they were most depictive of what most of the businesses were saying in their comments. So just looking for ways to get through this, had to temporarily close, limited by technology, employees are scared, they don't want to work, reduced efficiency, challenges to operate, couldn't fill the shifts they needed, and there's an issue with balancing work obligations with obligations to children, with a good amount of these businesses discussing childcare as a big hurdle to continuing business operations. NGOs showed more of a shortage of employees and more layoffs than the businesses, with 42% shortage of employees, 54% layoffs, and a little bit less cuts to employee hours. 57% of organizations noted they had to cut employee hours, with about 21 hours cut per employee as opposed to the 29 for the businesses. So that's just a brief of that. COVID-19 business assistance. So when we're looking at assistance applied for and received, the majority of businesses applied for assistance, and a little less than half received assistance. For those who did receive it, it was mostly from SBA loans, and it was pretty variable on how much it actually covered. I put two quotes up on the top because it did speak to some of the organizations and businesses that were left out or kind of fell through the cracks. So micro business, one person, as I quote, "I am a micro business. I don't seem to qualify for any support because I don't have any employees. I will have to close my business that I've operated for my entire career of almost 30 years. And to the right, top right, if the county could offer work, it would be very helpful, better than grant money, in my opinion, because our team really wants to work. That was from I believe, catering organization who wanted to get back into business and was hoping to help with the response. Okay. So for the COVID assistance for NGOs, one organization did note that environmental protection and conservation organizations were left out or fell through those cracks. Of the NGO surveys, 55% of the NGOs, 55% applied for assistance and 56% received assistance. Most of the NGOs did apply for SBA assistance, but most of them noted getting assistance from other NGOs or private donations, local government, although about 26% did say they did receive some type of federal assistance, more noting towards unemployment than SBA though. There's similar levels of need covered for the NGOs as compared with the businesses, but again, they're coming from different sources. So for the businesses, when we look at additional need, most businesses stated that they have the biggest need they have is financial, which makes sense, with about $149,000 of additional financial support needed. And most of them did state that the best way to get that money for them would be grants or interest-free loans. With that said, the reason there's a decent amount of unsure, depends on the situation, is because a lot of those businesses were taking this really early. And when we looked at April to June, you saw that unsure, depends on the situation, reduced severely, and the financial assistance percentage grew. Along with financial assistance, two of the other real big things that organizations did ask for was rent, mortgage, or bill relief assistance, and employee assistance in the form of healthcare and unemployment pay. So pulling from the additional concerns, especially from the initial survey, because we did ask open-ended questions, I got many paragraphs of responses, and I spent a few weeks reading them and pulled some of the quotes again that I felt were depictive of the overall group. So this is looking at additional concerns. Obviously, most businesses who are taking the survey are concerned for their business. So some quotes: our business model might never be the same, and we are not sure how to reinvent ourselves for the new reality. If this continues, my company cannot afford to operate at a loss and may be forced to shut down. Feels like we're back to ground zero. If our community fares well, we'll do well. We're in this together. Hard to see the light at the end of the tunnel. Might be a freight train coming. When will it be truly safe to resume face-to-face services? A lot of people noted they'd never seen anything like this before, with those exact quotes or very similar language. How do we provide enough testing to make certain that we can come back to work together? And how do we have childcare for our children? We are simply trying to hold on at this point in hopes that this will pass in a reasonable period of time. I can see the panic in my employees and customers. The stress has manifested physically and mentally. So looking at the NGOs, most organizations stated they needed additional assistance as well. A few said they didn't need any assistance, and the next largest amount of assistance needed was for supplies such as PPE, and hand sanitizer and the like. The NGOs needed a little less than $100,000 more than the businesses, so about $246,000 on average additional financial support needed. And when looking at the additional concerns, moving forward and receiving funding to continue operations in a changed economic environment, historically, nonprofits are the first to be hit and the last to recover in a recession. The safety and health of our community is our biggest concern. My greater concern is for small and mid-sized organizations that may find that they can't sustain the huge impact to both revenue and expenses amid all the uncertainty of what comes next. Our primary concern is COVID-19 prevention for the families we serve. The health and well-being of our volunteers, uncertainty of the future on all levels has us extremely concerned. And I'm 6 months pregnant. I'm scared to run out of money and food. So those are just some of the quotes we received. A lot of those did revolve around concern for customers, given that a lot of these NGOs do serve at-risk populations. So that's the overall of what we found thus far. I'm really hoping to push this further and continue it on until this pandemic is over, and probably a little after that, as we know that these economic impacts, they're not stagnant. We're going to see them change as we reopen and close, and fear grows and subsides, and the spread grows and subsides. So with that, I do encourage everyone to push out these surveys and help me spread them out so that we can get a more accurate representation of what's going on in our county.
Thank you, Luna, very much. That was a great presentation. I've had a request for your PowerPoint, and thankfully I have it, and I will share it with everyone who is on the call if they would like it. And
Absolutely.
Luna, if you would stay on the line in case we have some questions after our next presenter. I see Dr. Moreno is on the line, and he's going to give us an update from public health this afternoon.
Hey, Mia.
Hi, good afternoon.
Hi. So hope everyone's doing well. Hope everyone's healthy. Ed Miranda, Monterey County Health Officer. I don't. I have just a few things in terms of updates. Yesterday, I did issue a couple of health officer orders, and then information. The orders and the information about those orders are on our website. And one order was to rescind the local health officer's order that limited short-term lodging. Now that the county and the state are aligned in terms of permitting lodging, hotels and lodging for non-essential purposes like vacations, tourism. The local order that restricted short-term lodging isn't necessary. So that's been rescinded. And the second is an order that I issued. It has to do with requiring the local businesses to adhere to state and local guidance intended to protect customers, visitors, and workers. So the again, as the county has aligned itself with the state in allowing additional businesses to reopen, businesses can't reopen to the way things were. It's not business as usual. It's business in a pandemic. And in order to protect customers and workers, businesses need to follow guidelines, some guidance to assure that workers are afforded adequate protection from COVID-19 exposures. So the state has issued such guidance, and that guidance also, the state guidance also provides businesses direction on how to reconfigure and modify their businesses and their practices and the environment in which they provide their services in such a way that customers who choose to leave their home to come to their businesses are also afforded protections against exposure to COVID-19. So the order just makes it clear that in order to reopen, or if a business when a business sector is allowed to resume, and if a business chooses to reopen, that they do have to follow guidance. From time to time, the health department will also issue some guidance, and in those situations, the businesses would need to not only follow the state guidance in the sector in which they fall, but also any guidance that might be more restrictive here in Monterey County based on the needs, the circumstances, and the needs that we see to continue to allow businesses to reopen, allow for the economy to start to resume activities, and still balancing that with protecting people from exposure to this virus during the pandemic. So yeah, those are the highlights I have, and I'll give it back to you.
Great, and we've already got some questions, so stand by. Let's start with this one. What concerns have you heard about those with health conditions being harassed for not wearing a mask? We had one individual call who said he had COPD in particular. what health precautions should someone like that take despite being allowed not to wear a mask?
So thank you. It's a good question. So thank you for appreciating that people with certain medical conditions shouldn't be wearing a face covering. And then that was included in the our local face covering order. Yeah, so people who have heart disease or people who have certain lung disease, chronic lung disease, that with chronic symptoms or at risk for exacerbations of symptoms probably shouldn't be covering their face because it may make them anxious, and if they're anxious, they may start breathing faster or have difficulty, the sensation of not being able to breathe, or it may limit them, particularly individuals who have to use oxygen. So those individuals shouldn't. There's also people who just can't put on a face covering. They have certain severe anxiety conditions or other situations in which a face covering would be unbearable for them. So there's a variety of instances where a person would need to cover their face. In terms of what do we need to do, I think what we have to do is like we've been doing all along, and work together as a community. We're all in this pandemic. We're all at risk of being exposed to the virus when we leave our homes, at greater risk when we leave our homes. And so I think we need continue to have compassion. I think we have to have patience, and we need to listen to each other, and as much more now than we have in the past, and show consideration for one another, and have some empathy for those that would like to do their part to slow the spread of COVID-19, but can't for health reasons.
I'm going to ask a follow-up question to this, because I've had a question that has come into me often from people who cannot wear a mask. How do they explain that to a business, saying I have COPD or I have an exemption? Do they have to, show a medical card or have some phrase that works?
So, yeah, man. So this is new for all of us. And so whenever there's something new, I'm sure might have some guidance and direction on how to conduct ourselves, but it's still new. And so it takes some getting used to. So here in Monterey County, face coverings are required in certain circumstances, or in most circumstances when we leave our homes. But it's not required if you have a medical condition. And businesses still have the right to refuse service. That hasn't changed. I think what's necessary is for, again, people to be show courtesy, be patient. I can't tell a person what to say because everyone has their own way of expressing themselves, but what I could encourage is that both business owners and workers who should be receiving training from their supervisors and managers on all these new health ops orders and guidance should understand that the order in Monterey County does not require a physician letter to verify that a person has a medical condition. I think that's one thing that I think both the businesses and the workers in those businesses and people who can't wear a face covering need to both understand that you don't have to show a letter from a doctor. Basically, you have to just convey to one another what your circumstances and go from there. And again, try to have patience, consideration, and empathy for one another.
Thank you very much for that. After another large jump in cases, is there anything being looked at to pull back, and I'm thinking they mean go backwards and modify restrictions? Also, do we know if these increase in cases are from group gatherings or simply community spread for more openings of more businesses?
As we have more cases, and as we start, and as our indicators, some of our indicators have met the threshold. By all means, I'm looking at it with my epidemiologists. As necessary, I'll be in communication with the state to see what's going on with other counties and statewide, and to determine whether or not we have to make some modifications, adjustments to the course that we're on right now. But at this point, I'm not seeing anything that's not unanticipated. In other words, as we're in a pandemic, and we have been able to slow the spread of the virus, and we have a lot of people who want to get back to work. Schools that are preparing to allow kids back in classrooms, and as we move forward over the next few months, we can expect that we will have there's more opportunity for the virus to spread in our community as people have more may find more reasons to leave their homes. And so we do expect to see slowly increases in the indicators that we've decided to cover. At this time, there's no, I don't have any inclination to move to become more restrictive. I think we're going to if we're going to get this through this, and we're going to balance the effectively balance the people going back to work and helping our economy and with protecting our vulnerable populations and making sure our healthcare system will be there when we need it. We're all going to have to work together. We're all going to, if you're leaving your home because you're a customer and you want to go dine, you want to get your haircut, and it's I'm urging customers to follow all the requirements when you're out in public, and be respectful of the business owners and the workers who are the ones that are really trying to create a safe environment at their business to invite customers back. And business owners and workers, really encourage them to do everything they can to implement guidance to create those safer environments for customers. So we're all in this together. We're all going to move through this together, and we'll continue. Hopefully, if we can continue to practice the distancing, face covering, washing our hands, cleaning, sanitizing, disinfecting, and other measures, hopefully we'll be able to continue to reopen more businesses in the day moving forward. Thanks, ma'am.
Thank you. Do employees have any recourse if a business is not following the state and county guidance?
I think the employees, or actually I haven't encouraged employees to go to the state website and also go to our health department website to find guidance that is specific for the business or the business sector that they think they work in. I think it's important for employees to understand what is required of the businesses to protect the workers and protect the customers, because workers will have work if customers come to the business. So it's in everyone's interest to follow the guidance so that customers feel that they're coming into a safe business environment. So I do encourage workers to take a look at that. And also for workers, if they feel comfortable to talk about the guidance with their supervisors and managers, if they feel comfortable doing so, because some really good, oftentimes really good ideas and innovation and creativity comes from the workers on how to do things differently, because they're doing the work. They do it all the time. They know the work very well, so they will often have really good ideas that they can present to try to make the modifications in the business to follow the guidance so that they are more safe and the customers are more safe.
Thank you. On the Monterey County COVID-19 data dashboard, does the change, the phrase change under the case numbers indicate a change from 24 hours before or the day before? What is the time period for the change?
Mel, I really think
that's a Christy question.
Well, I'll have to. Well, I could call her after this and ask her, but I think I may not be answering the specific question. But I think what I'd like to convey is that we update the data every day. And it's since we've been posting data, the time of day that we post has changed over time. At this point, we're doing our best to update the data in the morning, whereas before we were doing it in the afternoon. So, but it's every 24 hours that we're updating the data.
Great. And I'm going to follow up with this reporter who asked this question, and we'll see if that covers it. Is non-essential travel now allowed, and are people allowed to travel outside the area around their home? That seems to be who would be coming with hotels being open.
Good question. So, our response to this virus has changed over time, as you know, and it's constantly changing and it'll continue to change. When we first started with early restrictions, we really were focusing on buying ourselves some time until we got more information about this virus, and buying ourselves some time in order to allow our hospitals and healthcare system to develop or implement their surge plans, and also buy some time for those that care for our most vulnerable population to implement their plans to have enough personal protective equipment and strategies to protect and isolate individuals that might have COVID-19. So those restrictions, in order to buy that much time, we had to be rather restrictive. And part of that was limiting travel to essential travel. So at that time, we had what was allowed to occur in Monterey County were essential services, essential functions, and essential travel was based on those essential services. So as we move forward, we're not, Monterey County in alignment with the state aren't necessarily reopening more essential services. What we're doing is opening up what we hope to be are the lower risk businesses and services in Monterey County. And as such, we have businesses and services that are opening up that aren't considered essential, but are lower risk for the most part. And so any travel to, I'll use like the hotels, that's open now for tourism. So if someone wants to take some time off and come to, say, spend some time at a hotel, that's permissible now. It's not essential. It may be, hopefully it is still considered, as long as the hotels follow the guidance, lower risk, but it's not essential travel either. So the idea of essential travel is, we can still talk about essential travel to go to work, for example, but there'll be some travel that's basically travel to engage in lower risk activities. And so I would say that as long as people are engaged in business activities that are permissible here in Monterey County, then travel to attend and participate or provide those businesses, those allowed businesses are also permissible, whether it be one of the original essential businesses or one of the newer lower risk services.
All right, thank you. A worker tested positive at the Marina Courthouse. What specific type of people are contacted? All employees inside the courthouse or only certain portion? Any visitor to the courthouse in the time period the worker was considered contagious? I think this is more about how a contact tracing work would be done.
Sure. So I'm happy to go over this again. We have whenever we handle this like we handle the other cases involving a work site during this pandemic, and it's very similar to the way we've handled cases of other infectious diseases in work sites prior to the pandemic. So we're continuing with the same practice, implementing our the usual protocols. When we get a report of a person who's positive for COVID-19, we call, we verify, we look at the lab report, we verify, we contact the individual, and if they share with us that they're an employee, We will often need to call the employer to determine, to let the employer know when this person was infectious, and the employer will let us know what days they may have been in the work site. And then we'll also identify anyone that meets criteria for close contact. And if we, public health, and working with the employer, in this case, the courthouse, can identify everyone that was a close contact, then we'll make contact with those individuals and let them know that they were exposed and that they need to be in quarantine. And the employer will work with us to make sure those individuals are not to return to work until they are cleared by public health. In the event that there are folks that aren't co-workers who are, for example, from the general public, customers, for example, who are close contacts, then, and we can identify all those close contacts from the general public, then we'll contact those people and let them know they were a close contact and they should be in quarantine as appropriate. If we identify a larger group of the general public who are considered close contact, but we can't, with the information from the employer, we can't specifically identify every one of them, but we know there's a group, but in that group there are people that we aren't able to identify specifically, then we would consider making an announcement to the general public. We've done that before. I think the one example would be when there was a case of tuberculosis, active tuberculosis at the courthouse in Salinas. We recognized that although we could identify the employees and contact almost all the employees, there were groups of employees and groups of the public who we consider had close contact, but there wasn't adequate records to specifically identify who they were. So we made an announcement to the public, letting the public know that if they were in the courthouse on certain days and certain times of the day, that they may have been a close contact, and instructions on what to do. So that the Marina situation is under investigation right now at this point. I've not been told that we are working with the employer and have identified some employees and are in the process of sharing information with them on the need to quarantine, how long they need to quarantine, what signs and symptoms to monitor. And at this point, we haven't determined that we need to make a public announcement because we haven't determined that there's a group from the general public that are considered close contact.
Thank you. And then another similar question, the Salinas DMV is now closed due to an employee testing positive. Do you have any information about that situation? Are customers being contacted? And would this situation warrant a public announcement?
The protocols that we're following for the DMV is similar to, again, what I just described. So I'd rather not go through all that again. What I can say is that it's under investigation, and we're working with the leadership at the DMV to identify any coworkers or folks from the public who we can specifically identify as being in close contact, and coworkers that are considered being close contact will be quarantined and not allowed to return to work. Fortunately, in case of these government buildings, as I understand, the leadership in those facilities have been implementing both the local health officer orders and guidance from the state, which includes physical distancing between customers, and physical distancing between customers and the workers, and physical distance between the workers, as well as face coverings. So all those things, as I mentioned before, are critical if we're going to continue to slow the spread of the disease of this virus and still allow people to work and people to go to receive services. One more note I'll make is that when we do an investigation like these, and like many others that we've done already, we can we generally often recommend that after the employers have followed public health recommendations, then the employer is welcome to reopen. But that's still up to the employer whether or not they want to reopen, and if they do want to reopen, when they reopen. But we definitely do make a recommendation as to when they can reopen, and then it's up to the employer to open anytime after that.
All right, thank you for that. That is the last question that I have in chat. Is there any other question for any of our participants today? Not seeing anything in the chat, not hearing anything. That's great. Thanks very much for joining us on this media briefing. We'll see you the next time.
Thanks, Mia.
Thank you.